RWJBarnabas Health, bringing the best doctors and services to your neighborhood. I'm speaking with Dr. Meg Fisher, a pediatric infectious disease specialist and medical director of the Unterberg Children's Hospital at Monmouth Medical Center. A series of house parties involving teens in New Jersey has made national headlines due to the spike in COVID infections under the age of 19. If parents are listening, what can they do to try and prevent this behavior?
Well, I think it's very difficult. This has to be a whole family affair, and I think that parents and teens have to be talking to each other and, trying to figure out how each of them is dealing with the COVID outbreak. With teenagers, I think it's important for us to make sure that they understand that they can get sick from this virus, that usually they won't get very sick, but that they can make other people very sick. So we need to kind of all get onto the same page that the only way we're going to get this virus really controlled is if we all pay attention and try to avoid getting sick.
Yeah, I think every kid at some point thinks that they are invincible, especially in their teens. As a pediatric infectious disease specialist, what can you tell them that underscores just how serious this health crisis is?
So, teens have their own idea, and you said it exactly correct. They have a feeling that whatever happens may happen to someone else, but it won't affect them. So what I would tell them is, while it's possible that you may not get sick, you may actually bring this virus home and make one of your parents sick or one of your siblings sick or one of your aunts, uncles. Your loved ones may get sick even if you didn't get sick. So we really need, this is a community deal, this is a family affair. We need to be looking out for everyone, and your part of it is that we need you not to get sick with this virus and not to get infected with this virus so that you don't spread it to other people.
I want to talk a little bit about vaccines, which can be very confusing for parents, especially now during the COVID crisis. Why is it important to stick to the regular vaccination schedule?
So we know that the other illnesses of childhood haven't gone away during this epidemic. And what we're very concerned with is that we've seen that the number of children getting vaccinated has dropped dramatically. So we're worried that those young children are not getting the vaccines that they need to protect them from meningitis, to protect them from whooping cough, to protect them from measles, mumps. And we don't want to have an outbreak of measles follow this COVID outbreak. So it's very important for parents to stick to those immunization schedules. It is safe to go to your pediatrician or to your family physician and really get your children immunized to protect them from the next thing. Probably the next thing we're going to see is influenza. And this is going to be an important year for everyone to get vaccinated against influenza because the symptoms of influenza are very much like the symptoms of COVID-19. And we would like people to be immune to influenza so that we're not even more confused when influenza outbreaks start in November, December, January.
You mentioned going into a doctor's office, and I think that's where some of the anxiety comes in. A lot of parents just don't want to bring their kids into a doctor's office right now.
I can understand why people are concerned. We know that there's a lot of people who are sick are the ones that go to doctor's offices. But what pediatricians have done is they've made their hours so that they see ill children at one time, well children at another time. In many physicians' offices, people do not stay in the waiting room at all. They're brought right back to an exam room, and then they exit without really running into any other children. So I think all doctors have been very careful about trying to make offices safe for everyone. I would really encourage parents, get your children in, get them vaccinated, particularly the young infants, but also your teenagers, because one of the vaccines we give teenagers is the meningitis vaccine for meningococcemia. So we don't want them to go unprotected because they're concerned about COVID.
Find the care you need at rwjbh.org. RWJBarnabas Health. Let's be healthy together.